Thank you for that. Okay. So I'm going to be quick to share some announcements. I'll do a cup of tea update to share how far we've come with our cup of tea presentations or events. And then we're going to go into our article summary and our community discussion. So we have some new folks here on our call. I just wanted to remind everyone that the event is hosted by the Canadian Retinoblastoma Research Advisory Board. And there's events and ways that we keep in touch with the community, retinoblastoma community, and we encourage people to get involved in our events and our research. And one way to be involved and just to be in the know of what's happening is to join the retinoblastoma research community. And you could find the link to join on our website, rbcanadaresearch.com. We often post about that on our social media, and a link will be shared in the chat as well. So everybody's encouraged to join, anybody who has professional or personal experience with retinoblastoma. There are some opportunities to partner in research, and if I miss any of them, please share them with us. So I'm looking for partners for future Cup of Tea events. The December theme is going to be psychosocial, and the March theme, we're going to be talking about Depict Health, a tool to collect and visualize all the treatments that a patient has gone through. So if anybody has interest in either of those two topics or experience in along their journey with something similar, if they want to reach out to me, and I would be happy to talk more about what the Cup of Tea would look like, and we could discuss the opportunity to partner. You could email me, or you could email retinoblastoma.research@sickkids.ca for more information about any of these events. To email me, it's ivana.ristevsky@gmail.com now. So change that contact information, please. We also have the Patient Advocate Committee for the Rare Pediatric Eye Cancer, or RPEC Biobank. There's monthly meetings where the Patient Advocate Committee gets together and discusses different aspects of how to raise awareness of the biobank and other ways to encourage people to participate. So there's a lot more that they cover. If you want more information, you could email retinoblastoma.research@sickkids.ca and to know when the next meeting will be. The upcoming events, the 1RB World Hawaii is the next event after today, October 15th to 17th. I believe the last time I saw the information on social media is that in-person registration has closed, but there's more information on their website, and you can contact them to find out more if there's any other way to view the event. Our next Cup of Tea will be in December, on December 17th. March will be, I'm sorry, I didn't update the dates. March will be the third Tuesday in March. And then save the dates for the 2025 Retinoblastoma Research Symposium happening April 5th and 6th, 2025. So that's quite a bit away, but we could start planning for anybody who is interested in attending in person to save those dates and start working around that in your calendar. Also, OPAC has parent drop-ins on the 8th floor, Monday, Wednesdays, and Fridays in the morning. I wanted to share an update. I haven't shared one since last year of how the Cup of Tea has been going. So this is our Cup of Tea event number 15. We've had 14 completed events since March 2021, and these occur quarterly, and we've kept up with that timing. Over the course of all of these 14 events that have happened so far, we have had 136 individuals who have attended at least one event. Of those 136 individuals, we have 44 with lived experience, 54 who are health professionals, 18 researchers, and 20 other. The health professionals cover all aspects of retinoblastoma care, with the largest being ophthalmologists. And other is a large number, but it just, some names are not very familiar, or somebody may have their phone number as their name. So that reminds me to let everyone know that if you could please put your full name in your Zoom view so that we know who everyone is and can say hello. Okay, so today for our cup of tea, we'll be discussing the article, Scoping Review of Vision Rehabilitation Services in Canada. The plain language summary of the article is available on our website. We also have a blog post about Vision Rehabilitation Services Canada, an organization who provides vision rehabilitation services. And you'll hear more about that in today's presentation. So our speakers today are Charles Campbell. He's a dad of a retinoblastoma survivor who experienced vision loss after secondary cancer. He's interested in the area of vision rehabilitation with emphasis on reintegration to a school setting after diagnosis. Charles has been a regular attendee of the Cup of Tea events. Atul Jaiswal is a rehabilitation scientist and assistant professor at Queen's University. He has previously worked as an occupational therapist and disability rehabilitation social worker. His research goals are aimed at advancing knowledge in the field of combined vision and hearing impairment, and to generate evidence to inform Canadian health and rehabilitation care. Atul Jaiswal is also the author of the article we're discussing today. We also have representatives from Vision Loss Rehabilitation Canada. Sue Marsh-Woods is the regional manager for Ontario, and Amanda Reason is the client's navigation for children and youth for Ontario. So I'll pass it over to Charles, who will tell you about the article and his family story.
Okay, thanks, Ivana. Yeah, big shoes to fill here. I've been here since the beginning. I think we've been doing this, so I know a lot of, now I know all the hard work that goes into doing this. So we'll give it my best shot here. I promised. I'm no intellectual, I can tell you that. So, but here we go. So on the first slide here is a picture of my daughter Caitlin, the tall one there. She's going to be 11 in January, and Charlotte there is she's just turned 6 today, in fact. So here's our story. So in January of 2014, Caitlin was born, and by April of that year, we started noticing the leukocoria in her right eye, and was quickly diagnosed later on with retinoblastoma, bilateral retinoblastoma. She was 3 months old at the time. We later learned that it was due to a 13q deletion, and was subsequently diagnosed with a mild form of 13q deletion, and as well as autism spectrum disorder and some development delay. And it's kind of all blends together. We're kind of not sure which one's the cause or the other, or they kind of all mimic each other. So it makes life interesting for us, doesn't it, Caitlin?
Yes.
Yes. Treated with immediate enucleation of her right eye, and then about 9 months of treatment on her left eye, which included cryo, laser therapy, and then local chemo injections. And then around September of that year, we transitioned into the radiation plaque, which lasted about a week. And that was successful. And we really had not a lot of treatment after that, just surveillance. And then finally transitioned to the eye clinic in 2019. So everything was great until about March of last year. And Caitlin started having headaches, and went on for a couple of weeks, and then transitioned into some eye loss, vision loss, and obviously concerning. Ended up back at Sick Kids and CTs and MRIs, and Dr. Malpatna waiting for us in the ER that night. I won't forget, but we had her first CT scan back, which showed quite a significant tumor in the orbit of her left eye. And the tumor was actually putting pressure up against her optic nerve, which was causing quite significant vision loss at that time. And then obviously didn't feel very good, right, Caitlin?
No.
No.
That was the day after Easter.
Day after Easter, that's right.
Out of bed.
Okay. So lots of tests and pokes and prods, and we were really preparing kind of for the worst case scenario. But after a biopsy, we learned that it was a type of cancer called Langerhans cell histiocytosis, which is quite rare, but luckily relatively treatable. And that was the cause of the tumor. It causes abnormal white blood cells to kind of clump together and form a tumor. It's interesting, I guess, where the tumor chose. And I think we've spoken to, I mean, between ophthalmology and Dr. Galley and Dr. Malapatna and Dr. Sheikh, it's, you know, racking our brains about how this could have happened and why here and why this. And I think at the end of the day, you're just a lucky kid. There's really no rhyme or reason. And even with the previous radiation treatment, I think we're all quite convinced that nothing really had anything to do with the other. At this point, maybe down the road, that'll change, but right now we don't know. So from there, her treatment continued with chemotherapy, and then now she's on a targeted gene therapy called dabrafenib, and treatment's ongoing. So we're doing much better than we were. But because of the initial treatment, she had total vision loss for a period of a couple of weeks, and then finally started coming back over the last year. And then from there, we received quite a bit of assistance from several organizations, including Sick Kids, the Interlink Nurse, and through Vision Loss Rehabilitation Canada. And it was a team of people that really helped us get back into school and back to normal life. How am I doing so far, Ivana? Good? Okay.
Perfect. Yeah, perfect.
Ivana said I had this slide at the end of the presentation, but she said move it up to the front so we don't run out of time. So on the left is a picture of Caitlin with the mayor of Windsor. Every year for January for pediatric cancer awareness, they raised the flag from a foundation here called Fight Like Mason, and she was the honoree. She got to raise the flag for the city of Windsor, and this organization, Fight Like Mason, does a lot of fundraising and supports pediatric cancer patients in Windsor, Essex County, and London area, this Southern Ontario area. And then we're in Windsor, if I forgot to mention that. So, and then to the right, there's a picture. She got to dress up like a princess and do a photo shoot, and she'll be in the fundraising calendar for next year. And incidentally, the town over that also raised the Fight Like Mason Foundation, the little boy that got to raise that flag was also this is another RB family that's treated at Sick Kids. So 2 RB families that got to raise the flags. So I got to read the article by Atul, and I just want to say I hope one day I can be as passionate about anything as Atul is about vision rehabilitation, and I think that'll come across here in just a minute when he gets to speak. But some key terms from the article: vision loss, which is uncorrectable, partial, or complete impairment of vision. Comprehensive vision rehabilitation refers to a multidisciplinary endeavor that encompasses the full spectrum of patients' rehabilitation journey after vision loss, from the initial assessment through intensive rehabilitation therapy. And Vision Loss Rehabilitation Canada is the not-for-profit national healthcare organization and a leading provider of rehabilitation therapy and healthcare services for individuals with vision loss. So the background of the article centered around vision loss in Canada. Around 1.5 million Canadians live with some form of vision impairment, and the demand for rehabilitation is expected to increase. And the research was aimed to answer 2 questions. One, how are vision rehabilitation services delivered in Canada? And if there's gaps that exist in the delivery of rehabilitation services, how can they be characterized? And it's a scoping review that's included 62 studies identifying the relevant studies found in various databases, selecting studies, data charting, and data reporting, which all sounds very cerebral to me. And I think there's a slide that so vision rehabilitation is delivered in 4 different types of settings generally in Canada. So health services organizations established by CNIB, to separate out the essential government-funded services of vision loss rehabilitation from the charitable programs offered by CNIB. Services are offered across Canada. Then there's the university-based affiliated vision rehabilitation centers, typically located in university-affiliated teaching hospitals. The services are provided by the ophthalmology and optometry departments. There's independent low vision service providers, and then there's the multidisciplinary rehabilitation centers, and that they're offered through the government of Quebec. I think that's good. I've got the next slide. So the study did identify gaps in delivery, and the one of the main gaps, which is what I'll talk about in a minute, is the lack of awareness about the benefit of vision rehabilitation. There's limited collaboration and coordinated services between eye care and vision rehabilitation services, delayed referral to vision rehabilitation, and shortage of specialists and insufficient funding. The gaps were characterized into three main groups: gaps at the service providers, so poor knowledge of vision rehab services available, and lack of collaboration with other eye care professionals. There was gaps at the level of the service users, so there's some stigma, lack of awareness, misconceptions, and lack of perceived need. And then there's gaps at the system level, funding, geographical considerations, and lack of specialists and outdated training. So in this slide here, when for a time we weren't sure if vision was ever going to be returning in any form, and when I mean vision loss, after the biopsy, Caitlin was completely blind. So we opted, not knowing anything about vision rehabilitation, we're going to do it ourselves. And this is right in the hospital. The first two pictures are about day 9 at the hospital in the library of sick kids, and Caitlin is trying to stack the cups in the right order so that they all fit together in according to size. And the next picture is Caitlin, and her task was to build the tallest tower that she could using the Lego blocks. And then the next picture is Caitlin in the sensory room at Sick Kids, which she loved, by the way, if you ever get an opportunity to go there. And from there, there's a box of like sensory toys. So she had to pick out a toy and describe what she was feeling.
No, you.
Oh, did I do it?
Or mom.
Or mom did it, that's right. And then the last picture there is Caitlin in her hospital room with one of the Campfire Circle volunteers, and slime was her favorite thing to do. But not just playing with the slide, she had to make the slide, mix up all the ingredients and mix it together and do all that stuff. So for the discussion, although the study identified 3 significant gaps, the service delivery of rehabilitation service, it was our experience that the services were readily available and very coordinated after diagnosis. So if there was a gap in our circumstance, it was at the service user level. And we didn't know kind of what we didn't know about what was available to us. And case in point is even just in the picture there, eventually we were set up with Maggie, the magnifier for school, where Caitlin was able to go back to school eventually using tools that were provided by the school board and through Mrs. P through her vision itinerant teacher, and options set up by Vision Loss Rehabilitation Canada. And I'm not sure if the slide's coming up, Ivana, but I just wanted to mention that, so that part of that initial coordination was done through Sick Kids through the POGO interlink nurse. I know there's an interlink nurse here that'll talk more about it. But in the absolute chaos at the time, Nurse Jess was absolutely fantastic with us in calling schools and calling vision loss and calling our interlink nurse, and everything was set up kind of for us, and would organize meetings with the school, and really kind of just took off from there. And everything from setting up meetings with the school about navigating the hallways and finding her locker, and making sure that she would be able to find the playground and not trip and fall and all that kind of stuff. So it was fantastic.
I did go to school with
That's
Mrs.
right.
P.
Okay, yeah, that's right, Mrs. P. So the research indicates that there are gaps in the delivery service of vision rehabilitation services in Canada, with an increasing number of Canadians experiencing some level of vision loss. The study aims to better inform policy to ensure that both eye care experts and patients not only have access to vision rehabilitation, but are aware of the services available to them. And again, in our case, that's probably the biggest thing, is what's available to us. And even with diminished eyesight, or now like fairly good eyesight, there's still lots of services that are available.
Thank you for that fantastic summary, and sharing your story. No, it was perfect.
Okay, good.
You summarized the article really well, and brought it back home by sharing how what it meant to you, and how it affected you. So I would like to ask Atul if he could share some information on what he thought about his experience with this information. And Atul, if you could share some information about if there was any research done for retinoblastoma specifically, and if we could learn from that.
Sure. Yeah, thank you so much for having me here, Ivana and Charles. I think I'm really very pleased to be here, because not only I got introduced to a unique health condition, which is very important, because when I use my research, like the slide that you see right now, I went on to PubMed, right, just to see that whether there are studies on this topic. And then I put these two keywords, because that's what I do in my life. Like, I just put keywords and then see whether there are enough evidence to advocate for things, right, based on the research. And only 7 studies have popped out, like pretty much, like, again, like you cannot see the full 7 sort of studies on the screen, but pretty much I figured out, okay, so there are 7 studies that are out there, and I have not put any limit. Like, so before 2016, like, again, there would have been more studies on retinoblastoma. I'm not saying that there are no studies on retinoblastoma, but what I'm trying to say here, when we club the vision we have with retinoblastoma, we only get 7 studies across the globe, and that's a big evidence gap that exists right now in this space. I think we need to do more with respect to the rehab aspect. I think we are doing good with respect to the treatment aspect, like the cancer treatment aspect of this health condition. But I think when it comes down to vision rehab piece, I think we have a long way to go, especially also in Canada, because I believe like the 7 studies that I found, 3 of them are from US, and pretty much from the same university, because I believe, like, just like the way we have sick kids, they have St. Louis Center for Kids sort of treatment, and they have published like the first 2 studies that you see are pretty much coming from there. And then, so like, most of the studies are focused on quality of life, again trying to understand the impact of retinoblastoma on people's life and then their functioning. And then I found like 2 studies from India, again something on retinoblastoma and impact, and then 1 from Australia and 1 from Israel. So that's what is the overall scenario. So like, Canada is nowhere in this picture, and I think that's what is one good sort of starting point for us. So regardless of, though we have not done anything here, I would suggest maybe this is a good starting point. So thank you, Ivana, and thank you, Charles, for introducing me to this world. I'm very happy to support you from whatever research understanding I have, in terms of doing something together, so that we could advocate better for our so like again, children, as well as anyone who's having the lived experience of retinoblastoma. We already have like the CNIB VLRC team members are here. Just to give you a little bit of context, I was finishing my PhD at Queen's University, and this was the last sort of, I'll say, the term of my PhD in 2019. That's where I got this opportunity to do this study, like scoping review. So this got published in 2021, but initially we started this whole review thing because when I was given this task of understanding the breadth of the vision rehab services in Canada, it was a Herculean task. I almost said, like, how can we do it? How can we map the services across Canada and then tell everyone in a one paper like this that you see right on the screen that what is going on here? But again, I would say, like, my study, like the scoping review, was like well intended, with the intent that we will showcase what is out there with respect to the vision rehab services in Canada. I still see there would be some articles, or there would be some reports, or there would be some initiatives that may have just got missed because of our own search strategy and everything that we did. But we tried our best to capture everything. Again, this study was a part of CNIB itself. So VLRC was just started there because the funding was provided from Ontario government, and that's what VLRC started. And then we did this study to understand what like what are some of key takeaways from this scoping review that we could use to inform the programs that are there. So I'm so pleased. And again, I will let the VLRC team members, Shiv and others to sort of, present about their part. But pretty much, I think the most important learning that I got from this scoping review was like services are there and it's a bit scattered across the provinces. So Charles, like I'm so pleased that you are in Toronto, right? And that changed your whole journey because you started with sick kids. Like think of people who are in far rural like parts of Canada, things would have been very, very different for them. I'm not sure like if there are others from other parts of Canada who might be in a similar situation and may not have access to the right care and right point of sort of services. But I hope again with the VLRC and the sort of the amount of like effort they're putting in, hopefully anyone and everyone who is having this condition may have access to care on time. So the one like few important points that I would like to raise here was like the early diagnosis. Diagnosis is a game changer. The sooner you get to know what is going on, the better sort of pathway could happen. But again, there is one most important person, the first point of contact in the healthcare system. If the particular person is kind enough and understanding and sensitive and empathetic towards this condition, they will ensure that your experience as a caregiver, as a family member, as a person who might have lived experience will be seamless. But if they're not like, again, they're busy in their own world and then they cannot put that much effort to provide that empathetic care, it could lead to a different negative experience altogether, which would put people out of the system right away. Because if the referral pathway that you had from sick kids to VLRC, if that was not created here, and that's what I found in my scoping review, that the referral pathway was very, very critical. Like so early diagnosis, the first point of contact, referral pathway. So all these are important elements that I'm highlighting here that change the journey, that could change the journey, right, of anyone in Canada. So I think like through my work, whatever I have done from the research side, I would say like we need to sort of think about these things. Again, funding, regulations, policies are bigger things. They will take their own time to come to place, right? But I think what we need to fix right now is the on ground few things that could be fixed without even putting a lot of effort and money. So that could be done here. So and then the last thing that I wanted to highlight was people often do not have proper understanding what is the VR and where does it start. So where does VR start? Like vision rehabilitation, where does it start? Whether it starts after the right diagnosis, whether it starts after the optometrist has done this, the assessment, or ophthalmologists have given their diagnosis, or whether it starts somewhere later. I think that understanding and that's I'll say that's what I found as ambiguous among healthcare professionals, among eye care professionals, and among general public, and among also people who may have people with lived experience of eye conditions in their family. So that's what so stigma is one big piece into the picture for sure. But stigma will come into the picture I think later on, but not immediately, because people when they are in that situation, maybe Charles could testify that when we are in that situation, you first want to get the best care for your loved one, right? You're not thinking about stigma and all that stuff. So you will first want to get the best care. So, but I think the aspect which will be critical is whether you can decide when are you going to see that care. So, and that would again change the journey, and that could again change the experience. So pretty much, I think, and then the coexisting condition like retinoblastoma is here. Autism came in between. I'm an occupational therapist. I know how autism could play a big role here, and then change the whole experience itself. So I think pretty much to wrap it up here, that like coexisting, and again that I could not elaborate more on this aspect in my paper, but I highlight in one sentence that coexisting health conditions could have a whole different experience altogether. So this retinoblastoma, and then again like putting autism or any other condition on top of that, could further complicate the scenario or further complicate the access to care. I think the moment we understand that people have coexisting health conditions, healthcare professionals need to work even more better. More sort of coordinated care has to be provided so that people are getting best care from both sides. And no one is left out. I'll stop here. I think Ivana has more things to cover. I'll stop here. Thank you.
Thank you so much, Atul. You are very passionate about this topic, and I love that you are such an advocate to get research going and to get care to the right people. And I'm glad we were able to have you on the call and for you to share your research with us. And you brought up so many points. So anybody who has any thoughts on what Atul has shared with us, we're going to dive into our discussion very soon. Next, I wanted to ask if Sue or Amanda from Vision Loss Rehabilitation Canada would like to share a little bit about the organization and how families, retinoblastoma families, can contact them and what kind of services they might provide for them.
Great. Hi, Amanda.
Hi. Sorry, my camera's lagging a little bit. Can you hear me?
Yeah.
Yeah.
Okay.
Absolutely.
Okay, good.
So do you want to start, Amanda, or do you want me to?
Whatever. Go ahead. I can
Okay.
jump in wherever.
Yeah. But we didn't get together and decide who's going to do what. So I guess just to say, Vision Loss Rehab Canada, of course, is across the country. And really, the services are somewhat fragmented province to province. For example, we used to have a program called Early Intervention in British Columbia, which worked with families of children birth to school age. And we lost that contract recently. I'm not sure exactly what happened. But I think that preschool age is really where most people, initially connect, but not always. If it's not brought to their attention, that early intervention program, I think, is fundamental, but the funding has been, rather disappointing province to province. Even here in Ontario, where we used to have 12 contracts, and Vision Loss Rehab did have staff on our teams that provided early intervention. But unfortunately, the government was not funding this program very well at all. And so we eventually, slowly, the contracts fell away. However, we still stay very connected to the EIS program, the early intervention program, because when those kids start school, going into JK, and they need our services, then we are going to be working with the families to make sure they get what they need at the various transition points. So Amanda, maybe you can talk about the role that you play, because it's very pivotal, being the child and youth navigator.
Sure. I think my camera's kicked me off again. Can you hear me?
Yeah.
Oh,
Yep.
it keeps going in and out. So
So
dear. My role is the client care navigator. I get the referrals for kiddos from birth until the age of 21, looking at services and supports that they are in need of, both in the community, as well as making some of those connections at school. So some of those kiddos that are part of the early intervention program across the province of Ontario that are now transitioning to school, the majority of their services and supports do come from school, because that's where they spend the majority of their day. However, in some areas, we have great opportunities with our orientation mobility instructor to go in to work in the schools with some of these students. Some of the school boards, depending on where a family lives, have their own staff that go in and work with families and work with kids. So a lot of our role is stuff during those school years that happens at home. So it could be looking at some support around those activities of daily living, looking at some orientation mobility around the neighborhood, around their home, those kinds of things, as well as looking at any supports around some of the vision aids that they may need at home that perhaps are too big and clunky to be lugging back and forth between school and home, so that they can complete homework and those kinds of things at home without having to have too much difficulty with accessing things visually, and whatever that might look like, depending on the equipment that they're using at school. So we kind of help get them connected with what they need during that time. And sometimes it's just connecting a family to a community support that might be helpful, that they're looking to enroll their child in brownies or Girl Guides or Scouts or those kinds of things, and being able to work with that organization and provide them with some support and some strategies around how to integrate that child into their program. find I'm doing a lot more of that recently with a lot of families to get them connected within their communities. Because a lot of organizations don't have that much experience with a child with some vision loss, and how do we integrate them and ensure that they're getting the most out of the program. So,
I might just mention one more thing because I think it's really important, and that is there was a time when we were all one CNIB, so
Mhm.
all of the rehab was still under that umbrella. In Toronto, we used to run March break programs and summer programs, which meant the kids could actually get together for their March break week, hang out with other kids with vision loss. And we spent a fair amount of time planning activities that were fun and engaging, but also taught some very basic fundamental skills. So the kids got to practice their mobility. But I think the connection between the kids was pure magic because, again, they might have been the only child in the school. So they felt accepted, and it really had a positive impact on their confidence. So I'm a very big supporter of peer support. So we still collaborate with the CNAB Foundation to try to, even if it's just like a one-day program we do on a Friday where the kids get together and make pizza. So they get to learn how to do those activities. What are those skills? Overnight, staying overnight, that kind of thing. We did a pajama party at the CNIB hub. So I think when it comes to services to children, I do think the key is parents being aware, because I can say in the last year, I talked to many parents who didn't know what we offered. And, the referral just didn't get to us in the right amount of time. And I think early referral, without a doubt, is the way to go, because even if it's just knowing what to expect, what are the resources, it reduces that anxiety and that fear a parent may feel. And then finally, the way the services of early intervention are delivered is meant to teach the parents everything they need to know about their child so that they can be empowered, and then the child gets to be empowered. So they learn to, maximize resources to be independent, which is really great.
Thank you so much for sharing that information. I'm sure there might be some questions afterwards. But before we move, if you could just tell us how, if somebody is interested in contacting Vision Loss Rehab Canada, what's the best way to do that?
Well, I would say contact our contact center 1-800 number, which is 1-844-887-8572. And wherever you are in the country, you'll get connected to our registrar, who will then, either fill in the community referral form with a parent. And then the next step would be somebody would contact to do intake. So depending where you are in the country, there's different ways where we've got children's workers in the West doing something similar to what Amanda does in Ontario. So we're blessed to have Amanda. She's terrific with this age group and really experienced. So the intake is really a conversation about what's happening and talking about, what are the gaps, what are the goals, and then setting the services up. So it's as easy as that. It really, ideally, we like to get a referral from either an optometrist or an ophthalmologist at some point to help support any funding of equipment. So very simple process. Go to the website. I could share our community referral form that's designed for allied health and parents and families.
Sure, if you could paste it into the chat, and then anybody who needs it can easily access it like that.
I'll try to do that.
We're also going to have, we have our blog post up already on our website that has some information about Vision Loss Rehab Canada, and I believe I've got the number in there.
Perfect.
But I'll share that information about that blog on our social media this week as well.
Super.
Well, thank you, Sue and Amanda.
Welcome.
I'm going to go back to the presentation and share our questions for the community. So we've had a great presentation by Charles. Thank you. And thank you, Atul, for adding more context to the research. Now, everybody who's here, I would like to hear from you guys. Anybody who has lived experience, if they wanted to share about their experience with vision loss services or any vision rehabilitation. For any researchers, is there any research regarding vision rehabilitation maybe that you're interested in now that we've discussed this? And is there something that we could get going then and get inspired to do? For any professionals here, I know we have Tina and Alyssa, both with the Interlink nurse, and Alyssa, our social worker for the RB team. If you can maybe comment on how the coordination between vision rehabilitation services works, kind of like who does what, is there, what part the sick kids do, what part do you contact the vision rehabilitation services to help families with, and any other comments about what we've discussed today?
Hi there. It's Tina. Thank you for the invitation to come and participate in tonight's meeting. It's an area of learning for me for sure. And Alyssa's online as well. And if I just started, but if Alyssa wants to continue or jump in, please do so. The POGO Interlink program is a program, an Ontario provincial program, and funded via POGO through the Ministry of Health. And we are nurses that sort of work within the hospitals, the tertiary centers across the province, the 5 tertiary centers, as well as the satellite center up in Sudbury. And we generally are referred to just to give you a little bit of our role in a nutshell, work with patients that are diagnosed with a cancer diagnosis that require systemic therapy or focal therapy. So therapy beyond surgery alone is sort of who we sort of get referred to. The retinoblastoma population is a little unique, and Alyssa generally refers to us when necessary, because she's such a great advocate for patients and families. So we work quite closely with Alyssa when the sort of need arises. So we would generally be connected to those patients that are receiving systemic or focal therapy or other sorts of therapy. And we help with seeking out resources, but also help with the school piece, as Charles so greatly described. So reaching out to school, vision itinerants is so critical for these kids, and getting those services in place really early on really creates sort of a seamless integration for these kids back to school. So really it's us sort of coordinating meetings and visits at school, along with advocating for other resources that these patients and families need. Yeah.
Alyssa, if I could ask you maybe to add on to that, what Tina has shared, but perhaps if you wanted to share with us what kind of services do retinoblastoma patients seek for vision rehabilitation, or do they? And then if anybody wants to jump in and share services they would like to have, or if there's something that they haven't asked for in the past but thought maybe they could have benefited from. Maybe we could come back to Alyssa. If there's anybody else who wants to comment about their experience of using vision rehabilitation services, or even curious about them.
Just add about it, RB is unique in that, like in many cases, the kids are diagnosed when they're, in Caitlin's case, 3 months old, just babies. So there's a big gap between the time that they're diagnosed and potentially would need vision rehab to the time that actually becomes practical. And I think in that case there, things kind of get lost in the mix by the time they start school. And as far as what do you need, and maybe you need all kinds of stuff, but we kind of didn't know. And it's unique in this case that we ended up back at sick kids with a new cancer diagnosis, that really we got all of these services kind of back up and running. But with RB, I'm not sure how much. Again, the kids are pretty resilient, and as far as parents, I don't know. Maybe there's all kinds of stuff that we could have done in the meantime.
And it's true, there's a lot of different scenarios of degrees of vision. So having a nucleated eye and having vision in one eye, having partial vision in one or both eyes due to where the tumors were growing, maybe having very good vision in both eyes. There's so many different scenarios of vision. It's so hard to blanket that. What do retinoblastoma families need? But I think one part of the journey that I think people think about maybe vision services more could be either going back to school or going back to daycare, or starting school or starting daycare, where things sort of come out of your own control as a parent, as a caregiver, and then somebody needs to look after your child during the day, and you kind of wonder how will they fare in a different environment, and whether depth perception might be an issue, or getting maybe if stairs are an issue, or I'm not sure if there's any other obstacles at the daycare or school that you might be worried about. Serge, I see you have your hand up. Would you like to share something?
Hi, sorry, it's Talene actually. We're sharing his user today. So like my question is, it's more like of a kind of like just like a thought that we both had too, is that like someone had just mentioned now, they made a really good point saying that most of the time these kids are diagnosed, you know, in their infancy. And I mean, by the time they're ready for school, they've already kind of like even sort of adapted to their environment, using just the one eye. In our case, our son has his left eye enucleated, so he's kind of adapted to that. And sometimes we even wonder just how much he's capable of. We're not certain with that. He does go to a private school, so we don't even have an IEP or anything like that. Like we basically advocate for him. We let the teacher know to always seat him on the left side because his left side is blind. It's his blind spot, so that they're kind of being mindful of that. But the question that we had too was just like, we don't know of any services available to us to help navigate certain things, like for when he's a young adolescent and he's ready to drive. Like we don't know what to do in that scenario. Like how do we have to prepare our car like with another, like a secondary mirror or something like that? Like how do we navigate that? So I think that there are gaps when it comes to information services for parents and families of retinoblastoma survivors. Like how can we safely in a way with where we're not stigmatizing, to kind of help our children navigate life, like with simple day-to-day tasks. Yeah.
I really think VLRC can help you in some of these areas. I think when it comes to driving, that's an area that you would really have to rely on the ophthalmologist to determine what's available for somebody driving with vision in just one eye. I'm not aware of any adaptations you would make for that, to be honest. But I think we are the resource for information. So Amanda, in that role, could be somebody that could be a contact for a family if they have questions. And I think certainly the transitions, so from say grade 8 to high school, you know, high school to university.
Yeah.
And I think the other thing is, like, can they manage their daily living skills? That's something that we strongly recommend kids are involved in chores, in doing everyday activities. It's really important.
That's what I'm noticing as a big gap, especially this year, for whatever reason, is that transition from high school to university or college for kiddos that are now living off campus or living out of home, living in residence, living off campus, all of those activities of daily living, laundry, getting from A to B, all of those things. And unfortunately, I've noticed a lot of families are accessing services, which is fantastic, except they're coming to us in like August, where they probably would have known about their child's acceptance to college or university back in April, where we've lost a lot of time. that we could have been working on a lot of these skills to get them college or university ready, whether that means living away or at home. There's still a lot. That's a huge transition, whether it be obtaining technology, whether it be learning the campus, learning those skills of independence, whatever that might be. We want to be on that as soon as we can. Preferably even the year before that they potentially could be going would be great. But that's not always the case. But certainly those big transitions like that, having the services and supports and getting connected, whether it be in the community or reaching out to the accessibility team, because they're all different at different colleges and universities, because that really is key to getting things in place for that.
Tina or Alyssa, have you received this question before from any other families, and have you referred families for support with driving somewhere? And then Atul, you'll be next.
I'm just waiting to see if Alyssa, she'd probably
Yeah.
be the better one to answer. Is Alyssa there?
I think she's having trouble unmuting.
Yeah. Okay. I haven't personally had any patients with questions about driving, for example, but again, like Sue had mentioned, maybe Amanda would be a good resource for that. This is great conversation just in terms of the interlink piece and how we can potentially become further involved with the retinoblastoma population, even sort of as Charles so eloquently said about, they're usually diagnosed very young. School or daycare is kind of way down the road, right? And potentially didn't get connected to an interlink nurse in the beginning because of the need or whatever eligibility. So it's great things for me to sort of bring back to my team and manager. And I think it's a bigger discussion to sort of explore our role with the RV population. Yeah. But I'm glad Sue and Amanda, that this resource exists.
And, I think too, when we talk about, is it too soon to start talking? Even when the diagnosis is made, my comment would be, no, it's not. Even if it's just information about what to expect, because I know in the last year, I've had a couple conversations where they had no idea what to expect, what's going to happen at school, and providing that information just made a huge difference to that parent. Oh, I get it. So that's what it's going to look like. So there's nothing worse than the fear of the unknown, and it's not common knowledge, right? So I think I'm a big believer in there's no harm in giving information early on.
Yeah,
I think it alleviates a lot of anxiety.
Yeah, that's a really good point, Sue, for sure.
I see in the comments, Alyssa has typed some responses. Yeah. She suggests discussing the issue of driving with ophthalmology. Yeah. I thought I saw someone. Did this Dr. Malpadna? Dr. Malpadna, if you comment if people are asking about this, but I also wanted to comment that Genevieve is not here, but she's always she's from Canadian Retinoblastoma Society and shares her story often, and how just from her experience often learns little tips and tricks that help her navigate life. And I don't believe she's had any issues with driving and has successfully done so with her monocular vision. If anybody wants to share their experience, like if anyone has, otherwise you could also reach out to Canadian Retinoblastoma Society and talk with Genevieve about that. Dr. Malapatna.
Yeah, thanks for all of this today. I think this has been such a valuable discussion all in all, and I think I have learned so much from today. I do want to say that there are specific requirements to qualify for being able to drive, and I think everyone's given us the link as well, and this varies from province to province. This varies from country to country. Mm-hmm. Everywhere I had to practice, I had to learn these different standards, and that's part of our training. I think more than anything else, I think we have to rely on two things. One is visual acuity, which is how much each eye can see, but we also have to rely on the visual field with both eyes open. And those two criteria go into telling us whether people are eligible to drive or not. But that being said, truly, I think these questions have come up a lot with older children for sure, but not so much. When you're starting things with treatment and right at the beginning, of course, because those are not your priorities to start with. I think what really strikes me is the resilience of these children I've watched grow, and how they are able to overcome these hurdles so easily. That always strikes me when that happens.
There's quite a bit of comments in the chat, so please take a look at that. But Atul, you were next quite a while ago, I already mentioned. So we have a few minutes left. You can.
I'm sort of just make a comment on. So I'm an occupational therapist by training, right? So, and I do see occupational therapists have a big role to play in vision rehab space. I'm not sure whether they are being referred. That's why maybe I wanted to bring it here, because when it comes to rehab, functioning is a big concept that we want, like functional independence. And OTs play a big role in enabling people to function in their day-to-day life, starting from when you get up, right, to do brush and everything else, and then on all the way down the line when you're going to school or when you're going to start driving, everything. So I think part and parcel of this whole journey, OTs has to have a little bit of a role. I'm not sure whether they are being referred as of now from the system. If that's not happening at this level, something is missing in the picture. I think maybe that's what I'm sort of hinting towards. Again, I'm not sure, Charles, whether you were referred, like whether Kathleen were referred ever for a OT assessment and OT support services, along with the VR service that we're talking about here. But they will have a big role to play. Yeah, that's my I'll say, like, I have done a bit of work in this space. I know OTs have a big role to play as well. So with respect to driving, I have been to INLB. That's what the study that I just pointed into this chat, where they have a simulator. But again, I think it varies, but because the provincial regulations may or may not work in your favor, right? That's what would vary. But I think proactive research and proactive reaching out to people, right people, that's what should be going on in the minds of our parents. Because if you start thinking way ahead in the game, right, you are better prepared to prepare your loved one for the next big challenge that's gonna come. So I think that's what I would say. Proactive approach in this space would be very much required. That's it. Thank you.
Thank you so much. I see Lynn and Michelle had shared some information how they've navigated with their vision, and Michelle even commented that her brother, who has similar vision to her, is a volunteer fire truck driver, so no issues in driving. And there was a comment about in Ontario getting your license. I don't see the message at the moment, but I had read it, and it was vision is tested with both eyes open, or it's looked at with the eye that could see. So having monocular vision does not stop getting a driver's license, as long as they can pass the test. And Alyssa had made some comments about how she does refer families who need vision rehabilitation when they're emotionally ready. And I think we could have so much more of a discussion around that topic and other topics mentioned in the chat and shared here today. But we are at our time here, and I know there's another meeting that some of our health professionals need to attend next. So I want to thank everyone for attending the call today. If anybody is interested in participating in our next cup of tea as a presenter, so somebody with lived experience, please contact me, and please follow us on social media for any updates and for notices of future events and partnership opportunities. And visit our website, rbcanadaresearch.com, for our blog post and for information about the cup of tea and lots more. Thank you so much, everyone. Have a lovely evening.